So we did a study at Yale where we looked at multiplex proteomic profiles, and we really wanted to study the impact of CRS in patients receiving different types of CAR T-cell therapy. What we hypothesize is that CRS is not necessarily the same in every disease group or for every CAR construct. So there's many CAR constructs approved now, both in lymphoma and myeloma. So we looked at two major groups of patients receiving CD19-directed CAR T-cell therapy, or Breyanzi, or liso-cel, and we looked at a group of patients who received Abecma or ide-cel for multiple myeloma. And again, these are two different disease biologies, two different disease refractory states, and in these two patient populations, we noticed specific trends in terms of cytokines. So we looked at several time points longitudinally. Longitudinally, we looked at day -5, right before lymphodepletion. We looked at day 0, right before CAR T-cell infusion, and we also collected on days 1, 2, 3, and 4. And these are patients who were admitted, and they were being tracked and monitored, and research samples were collected longitudinally in all these patients. And if we were to lump all the patients who received CAR T-cell together, we noticed similar trends as reported before, and elevated increases in IL-5, IL-6, and among other cytokines. This is something that has been seen in prior literature, but what was interesting when we kind of categorize or dichotomize between multiple myeloma CAR, ide-cel, and lymphoma CAR, Breyanzi or liso-cel, these two products were different in terms of cytokine signatures. And so the proteomic profiles were interesting to see what differences there are between them. So for Abecma or ide-cel, the myeloma patients, they had elevated levels of IL-5, and IL-5 was not necessarily a strong signal in Breyanzi patients. So the conclusion that we saw from this study is that ide-cel has a different cytokine signature, and potentially IL-5 is a potential cytokine that may warrant targeting when we're treating patients with severe CRS. IL-6 inhibitors that are FDA approved for neurotoxicity and CRS, these are products that were first found in lymphoma, but there may be other targeted modalities that we can use in terms of IL-5 inhibitors perhaps, or other type of inhibitors that can help with toxicity in patients receiving different types of CARs. And that's something that we need to look into further, validate in a larger cohort, and study in more correlative studies to see the impact of different cytokines and how they play a role in CRS, and also how it may progress to neurotoxicity.